for every, and if then just please sign off and we will repost the video. And I'm really, really excited. And I think you guys have heard my excitement in the last webinar and hopefully in my conversations with all of you. Dr. K and Jamie are here with us today. And I met him when I was at a conference in Ohio. And he saw one of our posters about postural tachycardia with another doctor, neuro-optometrist. And you all know how much I love neuro-optometry and I really push it. And that's really what everybody really has to get access to, better access to in the brain injury community. And honestly, I say this with just such love and a smile on my face. Dr. K was walking around with his laptop in the conference. Just spoke nerd to me. And I say that with absolute love in my heart. But he figured out how to help patients with brain injuries, with their vision and their migraines and things like that. And the story is just compelling. So I'm not going to spoil it for you. He has a wonderful presentation with Jamie, but I again am so thankful that he's here, and he will talk about Sally and what Sally is helping him and his patients do and how we're going to extend this further. So no further ado, I will mute myself. Pop your questions in the chat. Feel free to ask conversations or ask questions as well too. And I'm going to let you take it away, Dr. K.
Well, thank you very much, Lynn. And thank you for this opportunity. I'm really excited about this, so I really appreciate it. Let me jump right into the slideshow, okay?
Perfect. We can see it.
Great. Okay. Can everyone hear me okay as well? Great. So I want to thank again Lynn for allowing this to happen. And yes, I met Lynn at a conference in Ohio, and I thought it was a perfect fit for what we were doing in our office here. So very excited. Thank you, Lynn. I also want to thank Jamie, my research associate here in my office, and my technician. She helped so much with this process. And I want to thank Hannah as well, working with Lynn. They really did a lot of the work and they put this whole thing together, but I'm very excited. And so a little over a year ago, I was thinking about ways of helping to treat our concussion patients. I'm an optometrist, a neuro-optometrist, and I've been seeing concussion patients for almost 10 years now. And one common complaint I've seen in my patients is their difficulty with reading, with doing near point tasks like working on a computer, and headaches as well. So I was thinking of ways that we could use our optometric tools, eye drops, for example, and how potentially we could help patients. So just a little recap. Post-concussion syndrome affects too many people in this country and in the world. And the good news is that most people who have a concussion or a TBI, they do get better. In about 80% of cases, they can get better within a month or two. But a good 20% or more, it takes many months, and some folks, it takes years for their symptoms to get better. But it is a big problem worldwide, and we call it PCS. It affects many systems in the body. One system it affects is the autonomic nervous system, the ANS. The autonomic nervous system is a part of the nervous system that controls things that we cannot control voluntarily, like heart rate, breathing rate, metabolism, digestion, body temperature, but also it controls something called the sympathetic parasympathetic balance. So the sympathetic is the fight or flight state, and the parasympathetic is the rest and digest state. Most of the time, people are in the rest and digest. If something startles us, we go to fight or flight. We can go back to the rest and digest. But in a post-concussed state, much of the time is spent in that sympathetic state, the fight or flight state. And that's due to elevated serum stress hormones like cortisol and epinephrine. And so I was thinking about how the elevated stress hormones can affect the eyes and the vision. And what I thought was one reason perhaps that our patients have a hard time reading is because the whole focusing apparatus in the eye can get derailed by heightened sympathetic nervous system. In other words, a heightened levels of epinephrine and cortisol. And so the way that the focusing system in the eye works is that there's a lens in the eye. The lens gets thicker when you focus on things up close, and the lens gets thinner as you focus on things far away. Now, as you have increased levels of stress hormones, it's hard for the lens to get thicker and see up close. And there's some biochemistry involved in this, but essentially you have hormones that bind to receptors in the muscles that control the focusing apparatus that prevent the lens from focusing up close when you have a heightened stress situation. At the same time, you can have a situation where hormones that or molecules that allow the lens to focus up close, that also can be depleted. And so that can also make it so that it's hard to focus up close. So in a nutshell, in a heightened stress situation, it's hard to allow the lens in the eye to focus up close due to these biochemical mechanisms. So we did a study, and the idea was to give our study patients eye drops. But before I get to that, let me just tell you a few of the symptoms that we were tracking as well. So the symptoms that you can see here are all tracked by Sally, which is an app made by Lynn and her group. And with this app, we can have patients register and they can track their daily symptoms as they go through their treatment. And you can see here that there are many parameters that we follow. And one of the primary ones, especially the ones that have some of the highest incidence, are circled headaches. 21 out of 25 patients experience headaches, 15 out of 25 experience blurred vision, and 18 out of 25 experience eye strain and pain. So vision and headaches is a big part of post-concussion syndrome. So the question is, how is the focusing apparatus, how is that involved in these symptoms? And is there something that we can do to stop that process? And so the idea was to use eye drops that we have commercially available. One is called Timolol. Timolol is a glaucoma eye drop, and we've been using it for decades safely, and it's used to reduce the eye pressure, thereby improving glaucoma. And the other drop is called Vuity, and Vuity is a newer product, but it's actually a form of pilocarpine, which has also been used for glaucoma for decades as well. But essentially, the Timolol was meant to make it so that we can take the handbrake off the focusing system, and the Vuity is a way of putting the accelerator on the focusing system. So with these two eye drops, we can help the focusing system in different ways. And just a little breakdown on the study population. So we had about 22 female patients, 4 male patients, so 85% female. And you can see the age distribution here as well. And so in short, the results are here. So essentially, we looked at 3 different parameters. We looked at headache intensity, headache frequency, and the near vision quality. And so the headache intensity, we've noticed that 46% of patients who took the Timolol and the Vuity, the headaches either stayed the same or they got better. About 46% said that it got worse, and about 8% said it was not noted. And headache frequency, 58% stayed the same or got better. About 34% got worse, And the near vision quality, a good 92% of people said that they could see up close better. So what these results kind of show to me is that there's a certain subset of people who have post-concussion syndrome that might benefit from timolol and or Vuity in helping some of the major symptoms that they can have with concussions, which is headaches and near vision quality. So with that, let me go back, turn off this screen share. I'll hand it back to Lynn.
All right. Thank you very much. And so because we're being mindful of Dr. K's time and his patience, I want to open this up, immediately to folks who may or may not have a question. So we do have one question already. And the question is, does this study K include those with diagnosed vision issues caused by TBI? And how do you determine the stress hormone was elevated? Was that done first thing in the morning or after the patient's day began and the symptoms increased due to stressors over stimulations?
Right. So the first question pertains to eye problems that the patients have as a result of concussion. So I would say almost 100% of our patients who I see in my clinic have some sort of eye problem as a result of the concussion. Primarily, it's focusing up close, and that could be due to the accommodative system having a hard time seeing things up close, but also from something called convergence insufficiency, which is when the eyes have a hard time turning inward. So I would say virtually 100% of our patients have vision problems as a result of the concussion. A lot of them have had vision problems prior to the concussion as well. If they do, it's made worse from the concussion too. And then the second part of the question, so we didn't do any blood tests. We did not measure serum stress hormone levels like cortisol or epinephrine. So this was my hypothesis. The hypothesis was that one reason our concussion patients suffer from heightened anxiety and other sympathetic stressors is because of elevated circulating stress hormones. That was a hypothesis, and how that might affect the visual system. And that's why the study was started. But that's the next step. It's a great question, I think, and that's something that I'd like to pursue in the future if possible as well.
Yeah, I would like to kind of chime in because that's the essence of what we're doing here at Power of Patience and with Sally. We take ideas like Dr. K's, a pilot study, something that he was able to observe, and we published and did what's not just a case report, a case series. He had 20-something patients that we were able to look at their data and now formulate a much more rigorous pilot study where we will include cortisol measures as well as other endocrine functions and things like that. And so that was one of our first questions when we actually got to meet and sit down and discuss this. So that's absolutely on our agenda. The second question is, does insurance typically cover this cost?
Good question. Maybe Jamie can answer that question. You know the answer?
I believe so. So we use two different medications, and for the Vuity, I know very frequently people didn't have insurance coverage. That was that second drop, the sort of accelerator to the system. We've been recommending to patients that they use GoodRx, which has gotten them a pretty hefty discount, but there is still a cost associated with that medication. For the timolol, I believe we typically can get some coverage. Obviously, it varies with different insurance plans, and that's that, removing the brake medication. So that one there is some coverage for.
And
coverage depends upon state by state as well, too.
Right. Timolol is a generic, so it's typically very inexpensive. And the Vuity out of pocket can cost about $60 a bottle, something like that.
And this is one of the things that Mark Cuban and his group, MedCost Plus in Texas, I had met with them a few months ago. Their initiative is to take these costs of these expensive pharma medicines and bring them down. So hopefully we'll be able to kind of pull them in and get them addressing these issues for us as a community as well, too. The third question is there any way that we can contact you? And so I hope it's okay that we, at the end, I send out the link to the replay and Dr. K and Jamie's contact at the office, if that's okay.
Yes.
Right. What are you guys converting about? Will this benefit stroke patients? That's a really good question.
That's a great question as well. We do see a lot of stroke patients in our office, and it's interesting, their symptoms are different. So they don't have so much the convergence insufficiency. They don't have so much the accommodative dysfunction. A lot of them have a field cut in their vision. So they might lose 1/2 of their vision on the right side or the left side. And that can make it very challenging to read, but for different reasons though. So, but I'm thinking about ways to perhaps help them visually as well.
And what's interesting, I want to add in, again, my daughter Natalie had a TBI and then a stroke. And so for her cortisol was triple the normal level and it was inverted. So she never got out of that flight or even the freeze mode. And it took a lot of vision therapy, baby stepping the vision therapy through to get her cortisol levels down. And it also, we had to do a lot with nutritional support as well because her system was so drained. So I think, again, it may be a case-by-case dependence, stroke, TBI combinations and things like that. The question is a larger study being planned. So I think that's twofold. And I'm working on reaching Allergan, so they are the manufacturers of the product. So we can do a real clinical trial that could be, across the US, but Dr. K is actually expanding this because he's going to present this data at a conference in, is it Oregon that you'll be at?
Oregon, that's correct. Portland, Oregon, yes.
Yeah, so in this case, now this was retrospective. So now he's prospectively taking his patients with Sally and with this process to refine it even better. And what that does is that tells people like me, the stats person, how we can actually calculate the power and what kind of analysis we should do going forward with that pilot study. So this is what we are all about here, is to accelerate the research for us. And of course, everything takes money. So that's why we got to get Allergan to help us. Next question. This gentleman has photophobia and his brain thinks that lights are dangerous and he can't be near fluorescent lights, halogen lights, sends him off into a tizzy of a migraine. Any recommendations there?
That's a great question. I would say the vast majority of my patients have photophobia, just like you described, and it can be quite difficult to function even under low lighting levels. The good news is that if you are exposed to such lights under PCS, under post-concussion syndrome, it won't do any damage, permanent damage to your visual system or your nervous system. That's the good news. But it can make it very uncomfortable when you're having the symptoms. So there are products on the market that do help patients who have light sensitivity by blocking out certain wavelengths of light that are particularly distressing to concussion folks. And so there's a company called TheraSpecs, THERASPECS, TheraSpecs. They make a product called FL41, which is a rose tinted lens with the prescription or without, and it helps the vast majority of my patients who have light sensitivity. And there are different types of tints. You can have a darker one for outdoors and a lighter one for indoors. And many of my patients benefit from that.
Awesome. Next one, my daughter's taking injections of Emgality. Any experience with this, pros and cons?
That's a great question. Unfortunately, I do not have any experience with that, so I cannot comment, but I'm going to look that up. And please feel free to reach out to me in a few days and I can give you more information.
Awesome. Craig has struggled with migraines since the TBI and post-concussion syndrome for 2 years now. He does not notice problems focusing up close too often, even though his computer sometimes causes headaches, even ocular migraines. Since you mentioned the different eye drops to put the handbrake off the focusing system or put the handbrake on the focusing system, what are the differences in symptoms between persons experiencing migraines that would create the need to put the handbrake on or off? It's a really good question.
Right, great question. So I'm glad to hear that you're able to do some near tasks. You're able to accommodate and focus on things. That's good. But it sounds like you're having trouble with sustained activity on a computer screen. So there's two aspects to this. One is the difficulty of the focusing system to do a near point task. And that's where taking the handbrake off and or putting the accelerator on will help. But if you're able to focus okay already, that's great. But you have a hard time on a computer screen, then the eye drops may not be as beneficial. And it doesn't really matter if you put the accelerator on or take the handbrakes off. What's really happening is it's the flicker frequency of the screen that we're looking at that can make it difficult to spend time on a computer, despite the fact that you can focus well on the screen itself. And for that, there are options and solutions as well. So it's a flicker frequency, it's the brightness of the screen, it's the pixel density of the screen that can also trigger headaches and migraines looking at cell phones and screens as well in general.
You know, you just reminded me, I met the head of research and development at the optical conference after I left you, Jamie, and she is very excited to learn a little bit more about our TBI patients here. And at Zeiss, they have a huge neuroscience division specifically for optics. So I'm actually going to reach out to her with this flicker frequency and see what we might be able to learn. And maybe we can get them here to help us as well too. So thank you for that. Okay, next question. My reading when I relearned after the injury has been much slower. I had too strong of a prismatic lens prescription in the first year. I was nearsighted before my anoxic brain injury experience. There is no question, but what I'm assuming, Paige, if you wanted to kind of jump on and clarify, is there anything else you are asking?
I listened to the replay of your previous webinar about visual disturbances, and it's just interesting to learn about the different perspectives and things that can be helpful. And I'm open to learning about any studies coming up about things that can happen with areas like convergence insufficiency. Not exactly sure if that's really what I have or not. It's something about how my eyes don't quite go together in the same way.
Thank you for that comment, Paige. So indeed, most patients with traumatic brain injury, they have a hard time coordinating their eyes, making them work together as a team, and the eyes can come too close together, they can cross too much, or they can be too apart from each other. They can deviate too much, and both of those can cause eye teaming issues. And so, yes, that's areas of great interest to, I think, everybody in this field. Why is it that people have a hard time coordinating their eyes and to work as a team together? But we are working on that as well. Great question. And prism glasses can help with that as well. And it is true, you can have prism glasses that may be too strong or too weak initially, but also you could have the right amount of prism, but then months later or a year or two later, you might need a different kind of prism, which is why it's good to have periodic checkups with your specialist to make sure that the prism is appropriate at that time for you.
I see a regular optometrist, although they also have some more advanced testing available, and it's mostly been consistent.
Good, I'm glad. So I'm glad that it's been consistent and it may stay like that for a while, but you're doing the right thing, monitoring it, paying attention to what your symptoms are like on a regular basis, and seeing your optometrist as well.
And Paige, I will keep you up to date as with everybody else about as soon as we can get some research trials going. I have a question that was emailed to me that for a person that can't make it, and then we have another one coming up. The question is regarding hearing and vision. And this is an interesting one. This person has a horrible hearing, highly sensitive, particularly at night. It seems to get worse. And at night, when repetitive noises, as he wrote, happen, it made him become so blurry with his vision, and his glasses would not work, and it stayed for about a half hour, and he just didn't understand it. And so it definitely was triggered by a noise, and he knows that he has a hearing impairment. But what is it that he should do? Should he go to a neuroaudiologist or should he go to a neurooptometrist?
Great question. So indeed, sounds can also affect you with post-concussion syndrome in many ways. And there's a part of the brain called the thalamus. And the thalamus is like the router in the brain. It takes information from your senses, your sensory, your visual sense, your hearing sense, and it's able to integrate these and then pass the information on to other parts of the brain so that the senses can be interpreted and used accordingly. But many times in a concussion, the thalamus and the structures around it, the hypothalamus, they get injured. And so you could have something called hyperacusis, which is being very sensitive to sounds. And it could vary from loud sounds to repetitive sounds to the frequency of the sound. So it depends on the type of injury you have. But yes, sounds can affect. And then that can lead to other problems as well, such as vision problems simultaneously. The way it sounds like if it lasted for about a half an hour or so, you had blurry vision and then it went away, that's very consistent with what's called an ocular migraine as well. And that can be triggered by sounds also. And so an ocular migraine is you can have blurry vision that lasts about 20 to 30 minutes and then it goes away. And so, but that can be triggered by sound. So you're right about that as well. So everything you say is very consistent with post-concussion syndrome. And as far as a specialist is concerned, yes, I think a neuro specialist who deals with concussions and hearing would be great to find. A neurooptometrist you should have on your team as well.
Yes. Okay, I will relay that to him. Thank you. Where is Dr. K located? He is in Portland, Maine. He has a great practice. Yes, recording of this, I recognize that sometimes this goes very fast, but the recording will be posted on Sally as well as on our YouTube channel. So I'll start putting both channels out there for everybody. And you are very welcome for all this information to help you. That's what we're all about. Okay, next question. I'm starting my fourth round of vision therapy. I'm working with a neurooptometrist. I received a prescription for tinted lenses at my first evaluation. Dee Dee, I'm not sure what I understand the question is. Is this an improvement or are you asking if you should continue with, if you want to come off mute, feel free. Oh, Justine, I apologize. I'm sorry.
Hi, I was actually responding. Sorry, I have the recall for words. I was just responding to what you guys were discussing because I'm at year 5 of post-concussion. I was hurt January 2019. So I was just responding to what you guys were discussing because that's literally where I am with my therapy. I have a new neurooptometrist and I also have an audiologist because I have a hearing aid for tinnitus. They actually ruled out Meniere's, which I'm excited about, but they took my espresso away. So no espresso and no salts, which I'm actually okay with. But my espresso, they took that away because I have a oral fullness sometimes when I take the device out. So sometimes I have a tremendous pressure that builds up, especially with a lot of noise. So they're starting me with 25-minute sessions for my eyes and to see how I can handle it. Because my evaluation was 2 hours and it took me 2 days of recovery.
Yes, that's a very, not an uncommon story to hear at all, Dee Dee. So as I mentioned earlier, the hearing aspect of it is affected with a lot of people. Tinnitus is a big problem as well. First, I'm so sorry to hear that you've had symptoms for 5 years now. That's very difficult, process to kind of work through. But I commend you on seeking the help that you need and getting the treatments that you need as well. And the great news is that the brain is neuroplastic, as you know, and it continues to heal every day. So that's the good news. And you'll continue to get better as well.
I'm noticing that I also had a baby with my concussion. So I had a heavy plate 2019, but I wish you were the doctor on my reports, because many did not. Oh, sorry, I have a 3-year-old. Many did not take my concussion seriously. So my records look like reports, as opposed to a concussion is bad. It just looks like, oh, she just got bumped on the head. So it's causing me issues in court, because I was hurt at Costco. A stock person struck me on the head. So yeah.
Right. No, that your story is not uncommon at all, actually. So
I'm finding, unfortunately, and I'm very privileged to be in this community, because we're all learning together. So that I'll be part of the advocacy with the Brain Injury Association of America, and I'm deciding if I'll be able to do the challenge for May, the 62 miles, because I still have vestibular issues. I'm back in vestibular therapy. This is about my 4th round of vestibular therapy as well.
okay. Yes, it takes a whole team of professionals to help with concussions. So it sounds like you have a good team put together.
Yeah, and Dee Dee, I want to again applaud you. It took 18 months for us to get the real diagnosis for my own daughter, and then 4.5 years of continual recovery. You're at the doctor every day, and it does set you back. And I cannot stress, because that's the oscillation. If you remember the chart that Dr. K first put up, that's what happens between those office visits, and that's what's so important to capture. And so I have a really big question that I don't know if you can see it, Jamie, and pull it up from Teresa. It's long, and it's I've got a lot of details in it, and I'd like Dr. K to read it. But the thing that I want to mention is that we just finished with MIT modeling out mathematically how to calculate how bad the bump on your head is. And we actually can now do it. And it's called a decision tree. And so that is enormous. And we actually are publishing that with a researcher in Canada. And it's going to be at the Austin neuro something conference. Anyway, so it's a big deal. We now are the first to be able to tell you it's this bad, and it may take years to get better. And if you start to assign metrics and numbers to these injuries, it really starts shifting the way we can actually care for people. And that again is why it's so important, because services can't be administered correctly or given to people in this community. And again, I speak from experience, we had no help. And so until the state agencies really can know what is happening to the people, that's why this is so important. So so I applaud you. But Dee Dee, I also would like to help you, because there's a few lawyers that I have recently met, and maybe they can help. I don't know what state you're in, but at least we can help refer you to people that could make a difference.
I'm in Washington, D.C., and actually I had a bad attorney, and he botched my case, and I had to take it on myself.
Yeah.
So yeah, I'm at the appeals process, but I will accept any and every help that I can get, because it's quite challenging, especially when they put multi-etiological on there, and they have it for post-concussion syndrome, but I didn't have these issues until I got hit in the head, and the judge is not a doctor. So yeah, that's the issue, because they said they need an expert on my case. So I will
connect with you offline. So Dr. K, did you get a chance to read that long question?
I did, yes, Teresa's email. Thank you for the message, Teresa. again, sorry to hear about everything you and your husband are going through as well. So the accident happened about 5 years ago. And so your story is not uncommon at all as well, unfortunately. And this is an issue that's a big problem and as Lynn said, is trying to diagnose post-concussion syndrome in a timely fashion, but also having the right team of professionals with you to help with the different facets. Because in reality, there's no one treatment that's going to help with post-concussion syndrome. It takes a team of professionals, various disciplines to help with all aspects of it. And in your husband's case, it's hard to comment without knowing all the medical details, but certainly the first thing we have to rule out is any major medical problem, and that is by having a CT scan and/or MRI scan done, just to rule out any structural abnormalities with the brain. And so if that's clear, then yes, then the next step would be to find other professionals. You want to have someone who can be an advocate for you and your husband to be able to find the professionals in your area who deal with concussion specifically. A lot of times it's the PCP, but it may not be. So, but a good starting point would be with the vision and the eyes. So if you can find someone who's a neuro-optometrist in the area, they'll have, if they have been established in your community, they'll have people that they can refer you to in the various other disciplines also, like we do in Portland. So the answer is, make sure there's nothing major going on by seeing the neurologist, and then look for a neuro-optometrist. I would recommend that, I think.
I'm going to add in my daughter Alex, my oldest daughter's case. She had a series of concussions. The last 2 were caused by cars. The first 4 were sports, but it was the first one, a teeny little fender bender. She was at a stop sign, but she couldn't stop vomiting for 4 months and lost 40 pounds. And she didn't have 40 pounds to lose. So now all of a sudden she looked as if she was anorexic. And so it was an accident that we stumbled upon an upper cervical chiropractor in Atlanta, Dr. Chris, and he was one of our guests as well. So I'm happy to include that link. It's up on the same YouTube post, but her neck was, and when he did her exam, she started having epileptic seizures, and as a child through adulthood had no seizures. And it was all related to the neck impingement that actually happened from the teeny, you wouldn't think anything was wrong with her fender bender. So he was able to stabilize her neck. So the messages were able to go through, I believe it was the vagus nerve, the wandering nerve that goes all over. And she literally stopped vomiting. And so none of the medicines worked. We were at every ENT, every GI doctor, everything. She had more things up her nose, down her throat than you can imagine. And it was the same story that we're hearing over and over again. So there's functions, there's body parts that need to be realigned, whether it's eyes or necks or nerves. So sorry, but I had to kind of go off. I need you to look at an upper cervical, and I'm happy to again email you, find contacts for you through these connections that I have. Another one, this is a big one from Justine. If you can pull that up, Jamie, she's been dealing with this mess for 33 years. And I think she said she had 15 car wrecks, multiple concussions, many surgeries, way too many. And now she's using, I may be pronouncing this medication wrong, but Amavig, 140 milligrams a month, and sumatriptan. But the question is, will the eye drops be available in Atlanta? And I'm certain that they would be available in Atlanta, and which doctors would prescribe it. It's not over the counter, it is prescription.
Correct, it is prescription. And right now, I'm the only person who's doing this treatment, Justine, because it is a pilot study we're doing. The research is still ongoing. And so we have not really published the results in a way that the information can be disseminated to other professionals in the country. So right now it's just myself. But again, I'm sorry to hear about your story as well. With 33 years of having symptoms, 15 car accidents, and multiple surgeries, that's a lot going on. And there's so much of your current symptoms can also be a result of what's happened in the past as well. And so it's a lot to unpackage there, but certainly if you ever want to contact me, we can communicate in the future as well.
Okay, and how are you on time? It's 3:40, so
I'm good, Lynn.
okay. Michelle asks if we can introduce the TBI tree on webinar Wednesday. That's a great idea, Michelle. And I'll give you a little preview. It's we took 64, it's just injury data. It doesn't even have to deal with symptom yet. But we took all the injury data, which is 64 variables. Believe it or not, little Sally gets all that information. 1 million records. It was 700 and something patients that we gave to MIT. So MIT did this. So we cannot, we don't have any, oh, there's bias. Nope, MIT did it all. So when they finally analyzed it, it came down to 6 variables were your most important variables to define how severe that injury is. And it relates to the front of the head, the back of the head. If you were dazed, had incoherent speech, gender did not really enter into it, but the age at the time of your injury was very important. And I think those are all the main variables that go into the tree. So I will figure out how to bring that forward to everybody. And yes, we will do a webinar on that. Sheila Moore in Atlanta, I will contact you. You need help. And Dee Dee, you're in DC. Okay, I will grab those. Deji in North Carolina, also in Workman's Comp. She has autonomic issues. I think that's more of a statement. Dedri, if it's something that you want to come offline and ask, I don't see a question in there. Slew of health issues. We need to get a neuro-optometry doctor in Atlanta. Yes, we will. Justina will do that. Okay, I think that's all of our questions so far. So are there any final questions, closing comments, anything? You can come off screen, you can come off mute. I'm going to post this on our YouTube and Sally as well. I'll include Dr. K's contact information, his website. I will look for the folks that need recommendations for neuro-optometrists and the lawyers. And I will contact you directly, so you'll have my email as well. And now there is a Dr. Nancy, ophthalmologist in Emory, that just came into the chat. So there's another potential connection. All right. Okay, folks, if there's nothing else, then I will say thank you to you all. This Dr. K, thank you. You know how I feel about you and your team, and Jamie, you guys are the best. I'm hustling hard to get that clinical trial launched for us. So just stay tuned, people, because it will come. Next month, we have a TBI survivor. She was a Division I volleyball player, and she's going to speak about how she was persuaded, that's a nice way of saying it, that she should continue playing, and she doesn't have a TBI when she couldn't even stand up or see straight. And she then ultimately left all of that and became a chef so that she could address her own health concerns, her vomiting, her diarrhea, her indigestion, her food intolerances, and now became a nutritional chef, and just put out a really cool cookbook that has videos that play in it specific for brain health. So because you are what you eat, right? So I'm really excited to bring her on next month. She's out in California. And with no further ados, no last questions, that's it.
Thank you very much, Lynn.
You're welcome.
Thank you.
Thank you so much. This was great. Thank you.
You're welcome. Thank you.
Bye,
Appreciate it.
everyone.
Bye-bye.
Have a great
Okay.
afternoon.
You too. Bye-bye.
You too.
Thank you, Lynn.
Bye-bye.
You're welcome.